The following segment is sponsored by Northwest Honda Dealers.
Welcome back. In the last hour, we introduced you to our new project here at K2 called Kind is Better.
The idea is to use our platform to further the conversation about mental health, specifically as it relates to kids. At 4:30, we talked live with Kevin Ashworth of the Northwest Anxiety Institute. He said anxiety is the #1 thing people seek help about. And he said some interesting things about treating anxiety in kids. For starters, he said kids should build a tolerance to distress and parents shouldn't accommodate avoidance. He said kids who face their fears and practice feeling uncomfortable will be better equipped to deal with their anxiety. But there is a line, and that doesn't mean kids have to tolerate things that trigger a fear response for a good reason, like threats or violence. As parents, we know it can be tough to tell what's going on with your children, and they might not open up. It's often hard to tell if their behavior is normal or something that you need to be concerned about. We asked doctors for some warning signs to look for. It's a common misconception.
A lot of times when I talk to parents, they'll say, well, I know it's really normal for, teenagers to be depressed.
Child psychologist Dr. Alan Cordova says it may be normal for kids to be moody or grouchy, but there's a point it extends beyond teen angst.
Disinterest or increased conflict with peers often is both a reaction to mental health problems, but also can contribute to mental health problems.
Parents may start seeing changes as kids approach middle school age.
We expect a lot more of our older kids than our younger kids, right? And the other thing is that for older people, they're able to give more voice to their experiences.
Here are examples that typically show up in preteen and teen kids, according to the Mayo Clinic. Mood changes that last more than a couple of weeks. Intense feelings. You may see anger and frustration in your child for no obvious reason. Behavior changes. Your child may be fighting regularly with peers. Trouble concentrating. You may notice it in grades at school. And physical symptoms. Mom and dad may show sadness or anxiety when depressed, but our kids exhibit headaches or stomach aches. Dr. Cordova says it can be a tricky balance determining what's healthy.
We want to be careful about too quickly sweeping aside mental health problems as just normal adolescence. Definitely adolescence is challenging, but it doesn't necessarily mean that all teenagers are depressed.
When it comes to resources, we found out what Multnomah County is doing to help kids who may be struggling during their school day, which is where they spend the majority of their day, right? That's coming up tonight at 6 o'clock. One resource that is always available is the National Lifeline. You can call them anytime, day or night, 1-800-273-8255.
Such an important